The orientation of any joint is very important regarding its function and its integrity, and the orientation of the component bones which make up the joint is very important in that aspect. Now, how these bones are oriented depends on the structure of these bones, which is actually something that is biomechanical in nature. And if we specifically talk about the hip joint, there are total of 4 biomechanical angles which dictate how the joint is going to perform, and these need to be in their normal ranges for proper functioning of the joint. The 2 joint angles for the you can say the angles which are actually of the acetabulum are the center edge angle and the angle of acetabular anteversion. On the other hand, the angles of the hip joint has 2 angles which are actually of the angles of the femoral neck, or the angles of the femur, which are actually the angle of inclination and angle of the torsion. And in this lecture we're going to take a look at them one by one in detail, starting off with the angles of the hip. As I already mentioned, we have the center edge angle, acetabular anteversion, and these 2 angles are actually the angles of the acetabulum. Then we have a very popular one, angle of inclination, which is also responsible for conditions like coxa valga and coxa vara. So that is responsible, this angle, and this is a very popular and well-known one regarding the structure of the hip joint among the other 3. The second angle which is associated with the femur is the angle of torsion. So let's start off with the angles of the acetabulum. The first of them is the center edge angle. So the center edge angle is formed between 2 lines. One line is actually the vertical line passing through the center of the head, as we can see here. This is the center of the head, and it is actually a straight vertical line. If we draw a straight line from the center of the head upwards, then that is the line number 1. And then there's an oblique line which connects the center of the head with the lateral rim or the lateral edge of the rim of the acetabulum. And these 2 lines, one straight line and one oblique line, actually make an angle between each other, and that angle is known as center edge angle. Now, what is the importance of this angle? If this angle increases, this increases the coverage area of the femur by the acetabulum, and if this angle decreases, then there is more exposed surface of the femur upwards, which is not covered by the center edge angle. So in short, it denotes to the extent to which the acetabulum covers the femoral head in the frontal plane. The normal range for this angle is around 35 to 40 degrees. If it is less than 35 or if it is greater than 40, then it means that there is an abnormal alignment of the acetabulum, because it needs to be in the range of 35 to 40 for normal downward orientation of the acetabulum. As we already discussed previously, that the normal orientation of the acetabulum is outwards, downwards, and anteriorly. So downwards and anteriorly. So talking about anteriorly, so that anterior orientation of the acetabulum is because of the acetabular anteversion, or the angle of acetabular anteversion. Now, this angle can be seen in horizontal plane between 2 lines. So first line is actually an antero-posterior vertical line which is drawn from the posterior rim, and this one, which is a dotted line, as you can see here as well. The second line actually is an oblique line which connects the posterior rim of the acetabulum with the anterior rim of the acetabulum, and this line, actually oblique line, makes an angle with the vertical line, which is known as acetabular anteversion, and the normal value for this is 20 degrees, and this angle is actually responsible for the anterior orientation of the acetabulum. Now, the acetabular anteversion angle relates to how much the acetabulum surrounds the femoral head within the horizontal plane, specifically covering the anterior aspect of the anteversion. If it covers too much of the anterior aspect, it limits the hip flexion, which is required for normal activities of daily living like walking, stair climbing, running, etc., even sitting and squatting. But if this is not covering the anterior aspect of the femur at all, this can actually lead to anterior instability as well. Now, After discussing the angles of the acetabulum, let's move on to the angles of the femur. First of all, we have the angle of inclination, very popularly known as well, and it is also known as the normal neck to shaft angle, or the angle of inclination of the femoral neck to the shaft. So this angle can be seen in the frontal plane, and this is actually an angle between the shaft and the femoral neck. And if we draw a straight line from the shaft, and if we draw an oblique line which is actually in the longitudinal axis of the femoral neck, then these two lines make an angle with each other, which is approximately 125 degrees in the normal individual. And it is not actually 90 degrees like this, it is 125 degrees. Why? Because the femoral head orientation is medially, superiorly, or you can say upwards, and anteriorly. So for this superior orientation, we need a normal 125 degree angle of inclination. But if it is less than 125 degrees, then that condition is known as coxa deformity, which is due to a smaller angle of inclination than 125, and this even leads to further deviations in the lower extremity, causing associated genu valgum. If there's a coxa at the hip, it would also cause genu valgum at the knee joint. Moreover, if it is increased beyond 125 degrees, it can lead to coxa valga deformity, which will need to lead to genu varum. Now, genu valgum is also known as knock knee deformity, and genu varum is actually also known as bony deformity. So coxa vara would actually eventually lead to knock knee, and coxa valga would eventually lead to bony deformity. The condition in which this angle is less than 125 degree is called as coxa vara, as already mentioned, and the angle in which this is greater than 125 degree is also called as coxa vara, as already mentioned. And once again, coxa vara is associated with genu valgum or knock knee, and coxa valga is associated with genu varum or bony. Now, the last but not the least is the angle of torsion. And why is it important? Because I already mentioned that the orientation of the head of the femur is located or oriented medially, superiorly, and anteriorly. So for this anterior orientation, we need an angle of torsion. So the femoral head is not like this, it is actually like this. So it means it is anteverted. So it is anteverted in a normal hip joint. So how can we observe and measure this angle? So it is actually an angle between the axis through the femoral head and neck. Look, if we see this joint superiorly, so this is head and this is neck. So it is actually a line, we are actually drawing a line which is passing through the head and neck of the femur. And then we are actually drawing another line. If we look at the femoral condyles and we look at the posterior aspect of the femoral condyles, and we join the posterior aspect of the femoral condyles, and we draw a straight line. So the angle that this line, which is passing through the head and neck, makes with the line which is touching the posterior aspect of the femoral condyles is known as the angle of torsion. And it is usually not neutral, but instead it is greater than 0 degree, and the normal value for it is 15 degrees, which is known as the normal angle of torsion or the normal anteversion. If it is greater, then that is known as excessive anteversion. If it is less, then it is known as retroversion. During the early stage of life, when a baby is newly born, then they have actually a 40 degree of angle of torsion, but it decreases substantially when the person has increased age, and it decreases substantially even in the first 2 years of life. And a torsion angle of between 10 to 20 degrees is considered normal, and the ideal would be around 15 degrees. And angles that greater than 12 degree are known as anteversion, and angles less than 20 degrees are known as retroversion, and are moderately common and impact internal and external rotation respectively. And but 10 to 20 degrees considered normal range for the angle of torsion. So that was all about the angles of the hip joint. I hope you learned something new about it. So keep on watching sqadia.com for more lectures like this, and thank you very much.